Hey guys, hey, this is Dr. Laura Ricci. I am a doctor of physical therapy, a national board certified health and wellness coach, and an essential oil educator with doTERRA. And I wanted to talk to you a little bit about blood sugar balancing. And my personal functional medicine doctor, Dr. Eric Ehle, gave me some really cool information and research about balancing blood sugar and some tips for you. So I thought I would share those with you because I love the research. I love getting nerdy into all of this. So there are some studies that have actually reported that there is a 10% decrease in relative risk of microvascular complications such as diabetic nephropathy, diabetic neuropathy for every 1% that we reduce that hemoglobin A1C. So this is huge. Every time you reduce that by 1%, it can actually result in a 40% reduction in the risk of diabetes and complications like blindness or kidney failure or amputation, a lot of things that we want to avoid. So here are some tips for you that he recommended, and I wanted to pass them along. One is read The Blood Sugar Solution by Dr. Mark Hyman. I'm going to be checking it out and adding it to my list to watch for sure. There's lots of foods that can also really help to reduce your blood sugar. So things like cinnamon and ginger and turmeric. And I love the foods and I love adding in the essential oils as well because they're highly concentrated. So you can add these to your foods. You can cook with them. Berries, especially blueberries, chamomile tea, garlic, onions, leeks, chives, parsley, avocado, olive oil, flax seeds. All of these things, even lemon, can really help. So food is medicine. Keep those things in mind. Add those in whenever you can. You can actually add your cinnamon, and I love to buy it in bulk from natural grocers. It'll save you some money, and then you can put them in your glass jars and refill that way. But add in your cinnamon, and you can do 1 teaspoon per day in your tea. You can add it in, or you could do a drop of your cinnamon essential oil. Again, it's highly concentrated, or you could do half a teaspoon on your food as needed. And this is going to help to reduce fasting blood glucose levels. Your cinnamon essential oil is going to help to support healthy blood sugar balancing as well, which is awesome. And again, eating a moderately low carb diet is comparable to insulin therapy for diabetics. So food is medicine. This is really exciting stuff. And it actually lowered your hemoglobin A1C in the research from 10.9 to 7.8 after 3 months of doing that moderately low carb diet. So that's huge. Take a look at that. You could add in some supplements. One that I am personally doing is this berberine balance from Douglas Laboratories. You can get this from Dr. Ehle's office or online. This has helped me a lot. It's another great thing to add in. And I've also added in the black cumin seed oil. And this is a nice one that you can do as well to have on hand. 2 grams actually of black seed oil was associated with a significant improvement in hemoglobin A1C and a reduction there from baseline. So that is really cool. Other supplements that you could check out, there's one called Glycemic Manager, and it's a supplement by Integrative Therapeutics. There's another one called Metabolic by Thorne. Thorne's another really clean brand to get your supplements from. Obviously avoid the sodas, avoid the added sugar as much as possible. Use stevia instead of those other sweeteners. So I love the sweet leaf stevia drops that you can get. You can get these at your local health food store or Amazon. They're really nice to add in and use instead, and they've actually been shown to help to reduce blood pressure and blood sugar, which is really awesome. And also, you could do 600 to 1200 milligrams of lipoic acid a day, and that actually helps to decrease the symptoms of diabetic nerve damage or diabetic neuropathy, which is really huge. And exercise. So 150 minutes a week of exercise actually created a 58% reduced risk for developing type 2 diabetes. This is huge. Move your body, guys. Move your bodies. And Tai Chi, which is one of my personal favorites, I go to Tai Chi class once a week. When it was practiced twice a week for this study, actually showed over 6 months a reduced hemoglobin A1C. So something like Tai Chi can reduce that hemoglobin A1C, and that's the average of your blood sugar over 3 months. So this is huge. And Qigong, which is also amazing, really focuses on that breathing and that breath work. A Qigong group actually had an average hemoglobin A1C reduction of 0.8%, improved insulin secretion, and reduced anxiety, and just doing that 30 to 40 minutes a day for 40 days, and saw nice huge reductions in those hemoglobin A1Cs. So do some Tai Chi, do some Qigong, move your body, all of the things. And also acupuncture. Acupuncture is another great thing to add in for diabetic neuropathy. Metformin, which is a prescription medication that they often prescribe for diabetic patients, it actually depletes your vitamin B12, which is really important for a lot of things and other nutrients. So something to think about. That's why I really love to kind of use the supplements when I can. And I love that Dr. Ehle is integrative and functional and recommends those things. And there's some labs that you may also want to check out and talk to your doctor about if you're curious about this, if you want to see if maybe you have an underlying blood sugar issue. Definitely check your thyroid, do a complete thyroid panel to check those things, cortisol levels, your vitamin D levels, your RBCs, MMAs, ferritin, your C-peptide, fructosamine, checking that hemoglobin A1C also, and then asking to check your Glycomark. And this is really interesting for my personal blood sugar journey because my hemoglobin A1C and my fasting blood glucose was normal, but that Glycomark wasn't. And so we actually got to dig a little bit deeper and find out some things that were going on for me to support me. And also doing a 2-hour post 75 gram glucose load GTT with insulin levels test. So talk to your doctor about some of these tests, add in some of the foods that we talked about, some of the supplements and the exercise, and just little changes consistently over time can really move the dial and help to support you because blood sugar is a really foundational thing. It affects our sex hormones, it affects our energy. It's really one of those foundational pillars to allow us to live a healthy wellness lifestyle and thrive. So try these out, let me know how they work for you, and I hope you guys have a great rest of your day. Bye.